them is, that's a long stretch bandage. This is a short stretch bandage. What's the difference between a short and long stretch bandage? The short stretch bandage has a strong, they apply higher working pressure. What does it mean by high working pressure? High working pressure, when they do more movement, it provides more compression, less resting pressure. This usually appears in the board exam. I'm sorry, I'm a board review facilitator too, so I'm like teaching how to pass the board exam, so I'm like that too. So the ACE bandage is what we call the long stretch bandage. So they provide more resting pressure. So when the patients are not doing anything, they provide more pressure. But you want, for lymphedema, you want something that has a high working pressure because you want them to exercise. So once they exercise, this will provide more compression. So it will reduce the lymphedema faster, okay? So this is expensive though. So when you go to a lymphedema clinic, this one, you reuse them. The ACE bandage, you can only, if you notice ACE bandage, they're only good for 3 use and then you have to throw them away. So this one, you can ask the patient to come back with this. So you ask them to wash it, they can hand wash it, line dry it, and then you can reuse this one, okay? This usually costs about $8 to $10 per roll. So that's why very expensive in the long run. So the name of the brand is Comperland. They can buy this at Amazon. On the initial visit, you can charge actually for the supplies. Okay, so the one that I'm going to show you, 6 centimeters and the 8 centimeters. So when you do the wrapping, you always start with the smaller first, and then you go to the bigger size. Okay. This one is, we call it stencilas. This is for the finger or the toes. You can use this. This one is the foam. So this is like the white foam here. This one is, I don't know the name brand of this, but this provides protection of your skin. So before the compression. Sorry, my things is already. Okay. Again, educate the patient, tell them the rationale of your treatment. Make sure you apply the lotion. Make sure to check the contraindications as first too. Okay, so what I'm going to do, I'm going to apply this. The first layer, this is the cotton spatula. So, okay. So this doesn't provide compression, but just to protect the skin. Oh, I did it wrong. So it should usually a little bit longer. Sometimes I cut here, put the thumb inside. Okay, so pretend it's a little bit longer. I cut it so short, sorry. Now you have threads all over. Okay, so now the next layer. So you will see that they have like swelling on the fingers as well. So you're gonna start here, anchor it first, no compression at all. Then you're gonna wrap each finger. Here. Okay. So in order to keep it in place, sometimes you have to use your thumb in between. If you, the purpose is you don't want any skin showing, so you can anchor it like this, and then wrap.
Does it matter the direction that you wrap?
No, ma'am, not at all. And there's no compression at all. No compression at all. It's just that you're wrapping each finger, and it doesn't matter about, you know, the direction. I'm sorry, am I doing it so fast for you guys? No?
No.
Good? Okay. Is anybody sleepy or want to like dance and sing for us? So Sometimes I leave the fifth finger, or if it's really like swollen, you can also, you know, most of the time it's the toes that we don't wrap the little finger because it hurts them. But so I ran out, but I will, if they have swelling there too, you also wrap this one too, okay? So I secure this with the tape. Is it okay if you hold on this one? Okay. Like this. Thank you, ma'am. Okay, so the next layer will be this. Okay. Now, I usually add like a hole. You can make your modifications, but this is the way I do it, which is kind of comfortable for the patients. So I anchor the thumb area like this, okay? And do it again. Okay, this one is okay for it to be loose because it will not provide compression at all. So just have to protect on the wrist area. The same thing with the ankle. If it's too small, then you add more layers to protect that bony prominence here. Okay, and this time we're gonna be personal again. So can you make a fist? And then sometimes I put it here to anchor. And here, I usually like double the layer because when they bend the elbow, it hurts them if they don't have enough support. So you do what we call accordion. Okay. And then you just add it. Okay. And then again, 2 finger breadths just beneath that armpit. Okay. And then if you're gonna anchor it with a tape, make sure that you put like some skin protectant as well. Okay. Next one. So you're gonna start with this. Now there is a technique on this little one. So you're gonna anchor it first here. Can you spread like this? So when you reach, tendency for them is to develop some pocketing of fluid in between. We call it lymphatic lakes here. So what I do is you fold this here. Because again, your rationale is to provide more compression from here, and as it goes up, it will decrease the compression. So here, and then there we go. Okay, so you can do double or triple the layer. And then you do what we call figure of 8. Okay, figure of 8 is like they're crisscross like that. Okay, you feel it? Okay, and again, you make a fist here. So it's different when it comes to the legs. And then, because I'm using this, you can use this kind of dressing or wraps in the legs as well too. But I just demonstrated to you 2 different types of dressing. But this one is only used for the legs. You cannot use this for the arms. Okay. So this is how it looks like. Isn't it? It's pretty. So yeah. So here we go. And do you mind holding this for me, please? Thank you. Okay. So now that's your 6 centimeters. Now we're gonna go to the 8. And the reason why we're using the smaller, the lesser the dimension or the lesser the size, it provides more compression. So as it goes up, you're using a wider dimension. Again, your purpose is to provide more compression from distal and then decreasing to proxima because you want to push the fluid up. Once your compression is more here, then you're pushing more the fluid down in your arms. And one thing that you will check if you didn't do the wrapping correctly is when they come back to you and they have more swelling on the fingers, or there's some pocketing of fluid in certain areas. Okay, so now you're gonna start like this, and the same thing, figure of 8. So when you have an extra, just make it so loose like this, so no compression at all. Okay. And then after this, you will teach them exercises. Any questions on this? So skin protectant here, you can secure it with a tape on the top portion as well.
I have a question.
Yes,
You
ma'am.
said this would stay on for several days. So if you have somebody that's responding really well to the compression, and their arm decreases in size or their leg decreases in size and the dressing starts falling off, do you have them remove it and make another appointment sooner?
Yes. So the